All right. Well, thank you again for joining me for the first journal club of the Boise State University MSGC program of 2025. My name's Alysia Brengman. I already know some of you, but it's nice to meet some new folks here as well. Yeah. So just to review information about the articles I chose two different articles to present on. One is a survey from clinicians at a tertiary medical center in India. That is that first article of top knowledge, attitudes, and practice about the process of genetic counseling among clinicians. And then my second article is a review article, primarily based on surveying um, in the US along with the UK, general practitioners' experiences, attitudes, and needs on clinical genetic counseling services. So just some background about the topic I chose and why I chose it. As we know and is well established, genetic medicine is a field and specialty that just continues to evolve, and there's a greater demand and need that is just happening not only as our knowledge of medicine continues to grow and increase, but also the demand and knowledge about clinical utility of types of testing and what we can do in regards to patient care. Primary care providers, as we know, play a critical role in healthcare. Oftentimes, primary care provider for a majority of people are the, primary person that people see for healthcare. Folks don't always see specialists or may not have access to specialists. So primary care providers are oftentimes, the one or main point of contact. And we could consider this as an accessible point of contact for patient care and communication. And also just looking further along with this topic, assessing different perceptions and knowledge about genetic medicine is an important first step in addressing, how we further integrate genetic medicine into potentially primary care and further into other specialties as well. Some additional background about this topic. Um, ge- General practitioners, as previously mentioned, are typically the ones that will refer patients to genetic medicine for services like testing and genetic counseling. Um, the systematic review article often refers to primary care providers and general practitioners as the gatekeepers of the healthcare system. And I feel like this is a really appropriate term for general practitioners because they are often just that main starting point for specialty services, management of care, and also just chronic medical conditions. And again, usually that primary point of contact for people. Another thing that is noted in the articles and it's kind of well established in the medical community is that there is an importance of genetic medicine and that it is an evolving need in patient populations. And there are several barriers to accessing genetic medicine, genetic counseling, and testing. For these particular articles and studies, some information that is contributed is just additional insight into perceptions of general practitioners along with various specialists. We get the perspectives of medical providers in multiple countries across the world and across different cultures. And we can also get further information about specific barriers for access to genetic medicine and barriers to referring patients that medical providers face within various specialties. So I'm going to start by talking more about the article, the systematic review regarding general practitioners' experiences and attitudes regarding genetic services and experiences with genetic medicine. So as stated, this is a review article of peer-reviewed studies that were published between 2010 and 2022. I believe the article stated that they started out initially with a group of hundreds of maybe approximately 800 articles just on their initial search method using their initial search methods of 4 large databases. And upon further limitations and filtering through, repetitive uh, listings of articles, along with their exclusional criteria, and filtering through different topics that they wanted to specifically focus on, they ended up with 62 different articles that were examined for this review. They used mixed methods appraisal and qualitative analysis. Some of the exclusionary criteria that was included in this review article included having the article's primary language being in English for assurance of understanding, so articles that were translated from different languages were automatically excluded. Also, studies that were not peer reviewed were also automatically excluded. So those were 2 big methods that they used to sort of weed out and exclude different articles. As we can see here on the right, this is really a breakdown of different types of studies that they included. There was a big mix of both quantitative and qualitative studies that were included for review. And I feel like this was good to get sort of a well-rounded assessment and review of this very niche topic. Also, there were different countries that were included for the article of origin. Primarily, we can see the UK and United States were the most included origins of the articles that were reviewed, and also Canada, Australia, Asia, South Africa, and New Zealand. Sample sizes, areas of focus, and different types of genetics were also assessed, also with study quality and different response rates were also included in that breakdown, as you can see. So methods that were included in that second article, knowledge, attitude, and practice about the process of genetic counseling among clinicians. This was a study that was done at a centralized tertiary, goodness, medical center in India, and it was also a teaching hospital. They had sent out via email a survey to 60 different clinicians across multiple medical specialties, various medical specialties just throughout the hospital, including primary care. And a total of 42 clinicians responded. There were 15 questions in total with 3 different themes broken down within the 15 questions, 5 questions each within those themes. The style of the survey were statements with a Likert scale for response options. And a Likert scale is that style of analysis where there is a sort of statement or question, and there is a scale of strongly agree, agree, neutral, or you know, no particular feeling one way or the other, also disagree and strongly disagree. So that type of scale for, a multiple choice type of option there. From there, the analysis was done just statistically to kind of see, again, what the majority of responses were. And the 3 categories that were included in this survey were the knowledge of clinicians regarding genetic counseling, attitudes of clinicians regarding genetic counseling, and practice of the clinicians regarding genetic counseling. And 5 statements were included in each of those 3 categories. So in going into the results that were found in the systematic review article, there were several, main points that were discussed in the results. So I'm going to go over some of the top themes and go further into discussion of those. Um, Overall, a major theme that was discussed in various sections of the results was that there was an overwhelming agreement about the benefits of genetic testing and the impact to patient care and the importance of identifying risk for genetic conditions. There seemed to be overwhelming support for genetic counseling and testing, and a majority of the studies that seemed to be a central theme that was reported. There was also in sections that more talked about different barriers to genetic counseling and testing reported by general practitioners. General practitioners reported severe limitations due to time constraints, lack of support from clinic leadership, and also the structure of healthcare system, and also within the clinics themselves, also patient demand, all those things that we think about when we consider all the strain that we put on medical providers in general, but also general practitioners that are often seeing, just several patients within a day or a week. Additional information about some of those other barriers that were mentioned in regards to general practitioners being involved in genetic testing and counseling. And there was several reports in different studies about a limited knowledge and lack of educational opportunities in regards to getting more information about genetic medicine, and a lack of confidence then in discussions with patients who had questions about genetic medicine. And in directing patient care, physicians reported not having, confidence in how to integrate that, and preferred to really defer to the experts in genetic medicine just due to that time restraint and knowledge restraint. Also, I found it interesting that there was mention of with the rise of direct-to-consumer genetic testing specifically, um, general practitioners reported that there was a lack of confidence or uncertainty in really the differences between that direct to consumer genetic testing and also clinical genetic testing, assessment of the clinical utility of each, what really are the differences, and how do you filter through all that knowledge between those two types of genetic medicine and explain it to a patient and also integrate it into that patient's medical care. And that was another reason that was sort of discussed as to why general practitioners cited preferring to defer to the experts in genetic medicine and genetic counseling. Results in the second article, that study, or I'm sorry, the survey done in clinicians in India, in that tertiary medical center, is similar to the review article. There seemed to be overwhelming agreement about the benefits of genetic testing and the impact to patient care, along with identifying individual risk for genetic conditions and risk for genetic conditions within the family. Something interesting about this article that I found that wasn't really discussed in the review article was that there was a big focus on public health, along with the burden of carrier frequency and the amount of people in the population with genetic conditions. There seemed to be a lot more concern and focus on genetic counseling and testing from a public health standpoint as opposed to an individual standpoint. So I found it interesting that that discussion was really shifted. Um, I did a little bit of research onto this. Didn't want to go too hard into that discussion and take away from these two articles, but found that there is often an elevated carrier frequency due to practices of consanguinity and endogamy still being more common compared to uh, the general rates of consanguinity and endogamy that we see more in individualistic cultures or westernized cultures like the United States. So there seemed to be, again, more of a focus and concern about that and carrier frequency for some monogenetic conditions um, was up to about 1 in 25 in some cases, or even elevated to approximated about 25 to 30% in some cases. It was estimated that that percentage of the population were a carrier of some genetic condition. And there was also an emphasis on the importance of gathering multi-generational family history, patient education, and also cascade testing. So again, a lot of focus on kind of the bigger picture consideration of family, and a little bit less of a focus on the impact to individual. So very just holistic and inclusion of the family along with that individual and personalized impact. Um, Providers also cited that another important part of genetic counseling being integrated was referring to support groups and additional support once people are identified as having a genetic condition or a family having a genetic condition. So that was another point that was emphasized as being important to the providers that were surveyed. To go over some limitations of these studies, um, starting with a focus and consideration of the review article. One big limitation that we see with review articles is that we can't control or researchers can't control every variable within studies. They're just pulling through so much data. And even though researchers are very stringent and filter out a lot of those studies and have pretty strict inclusion criteria, we can only control so much and interpret so much of the data equally, so to speak. So this can be a limitation in really analyzing and applying the findings. There are also smaller sample sizes in some of the studies that were included in that review article, and in addition to that other article of physicians in India. Very small sample size and very small population of respondents that were sent the survey. Also, research availability of this specific topic. It is a more niche topic, looking into and researching physician attitudes about genetic counseling and testing. So there's not a whole ton of information, when we're comparing to those larger subjects. We're just a bit more limited in how we can take that information and interpret it and apply it. One point that was mentioned in the review article in discussion was also that it was found that physicians or general practitioners that had a personal interest in genetic medicine were more likely to respond to surveys or requests for interviews regarding genetics and knowledge of genetic medicine. So that was an interesting thought to me that I hadn't necessarily considered. Um, so again, with a grain of salt in that sort of limited niche of respondents and availability of studies, it's hard to apply that information because truly not all practitioners are surveyed. Some next steps in this area of research are looking further into genetic counseling integration into primary care and other specialties. We can see more frequently that multidisciplinary clinics are integrating genetic counselors into their regular care models. Oftentimes we see this with oncology, the big three into prenatal and pediatric genetics clinic, working with other medical providers in, in tandem. Um, Also, educational opportunities for providers. One, again, big reason or barrier that was cited in various studies was that general practitioners and other medical providers as well just don't have as much of that genetic knowledge to feel confident in integrating that into patient care and advising patients on genetic testing and in various topics in genetic counseling. And reasons for that were also cited that there aren't as many educational opportunities. There are so many time constraints and demands on physicians already. So, further consideration of what type of educational opportunities and interventions would work for providers is another area of research that we could look into and further perhaps empower physicians to share that knowledge and use it in their practice. So some additional points for discussion are, initially just despite support for integration and expansion of genetic medicine into primary care, more specialties, and more patient populations, we're limited. We have limited access and limited implementation of genetic medicine services. How do we start breaking down those barriers? And also, general practitioners, again, report having severe limitation for opportunity for education. Systemic and structural limitations within the healthcare system really contribute to that. And how do we make those educational opportunities regarding genetic counseling and genetic testing more accessible and in regards to direct to consumer testing and more patients having questions about that specifically compared to genetic counseling within a traditional healthcare system or medical specialty. How do we empower general practitioners to feel confident in discussion in those discussions as well? And I am just going to share my references really shortly, and then I'll stop sharing my screen here for discussion. Thank you again for your time in discussion of my articles. And here are my references used. Just going to stop sharing my screen here.
Thank you. That was a really good presentation. I really appreciated the topic. I think it's really interesting that there's not more research going on this area. Like you pointed out, it's an important area, but it's also, I think, very good for us to be aware of as genetic counselors about the lack of research into this topic. So thank you for bringing that to our attention.
Yeah, it definitely seems like that's one of the biggest barriers is we know a lot about constraints on physician time and that again lack of time for educational opportunities and um, just how do we address that? And truth be told, the research being done into that and how do we start addressing those barriers is uh, maybe pushed to the side a bit when we think about, again, those bigger topics that are in research and just not having as much of that supporting information certainly makes it even harder to know how to start addressing those barriers. Having more of a foundation would definitely be more helpful, I think, to us in that regard.
I agree. And it's also interesting because general practitioners and other healthcare professionals, but genetics is not a main focus of their education from what we hear, right? Like in their curriculums and all of that. So the exposure sometimes comes after school. So it's interesting to get these topics out there just to even know how to approach that gap. Um, so that they even know like who to refer cases or when to refer cases, right? Like we really need to understand how they feel about the profession in order to then, you know, educate and be strategic about how to reach the professionals that need our help.
No, I absolutely agree. That was, I didn't really touch on this very much in the initial slides and presentation, but that was another sort of reason that was cited in that review article was that um, a large percentage of practitioners don't know how or where to refer their patients when they have concerns about genetic conditions or genetic testing and questions. So again, it seems like that lack of knowledge piece is just really a big chunk of it, and it's another piece of okay, how do we include that in their education, or initially or while in clinic? Again, what type of educational opportunities would be helpful for this? It's hard.
So why did you choose this topic?
So I chose this topic because genetic medicine is really not as accessible as it needs to be, especially as we learn more about genetics and precision medicine and the benefit that patients have, when just integrating that into their medical care. It's a ever expanding field. Um, and also something that, Jen, our program director, has mentioned this before, talking about the belief that genetic counselors should also be in primary care. So that thought also kind of in in line with my passion and interest in patient accessibility to medical care, that sparked the thought of, well, what if we did have genetic counselors in primary care? How do primary cares providers even feel about genetic counseling? Like, let's look into this a little bit more. That was something, or started this thought train started, a, a while ago, even halfway through the first year, just considering more, okay, how do we expand access? Well, one big point of access is with primary care providers. A lot of folks essentially only see a primary care provider again, and get a lot of their medical needs met there. So having genetics as a specialty is just another example of like a large barrier.
Mm.
I
So,
agree. And also like when you go through primary care, right? Like I mean some doctors know what questions to ask to raise some red flags, right? Like, oh, it sounds like you have a family history of this or the other, but it's hard for people without the appropriate training to do so. So having a wider access to genetic services, genetic counseling services seems like, it would really bridge that gap in a good way. So this discussion kind of brought that to my head. And the second thing that I was thinking was the more direct to consumer tests, right? Like I can imagine people coming to their doctors like, oh, I need this 23andMe, like, and then it told me, I'm at high risk of whatever, like, what does the doctor do with that? Like it would be interesting to even see some of that, because like you said, like a lot of people go and see their primary care physician, like even to get a referral, right? Like, I mean, insurance tells you to go to your PCP first. So it would be interesting to see, even from that perspective, when people take, like their consumer initiated testing, how the follow through then happens. Thought.
yeah. But I thought it was a great article, both of them. And I did have one question though, because one of the articles took place in India, and it wasn't anywhere except India. And I don't know anything about genetic counseling in India. Like, do they have a lot of genetic counselors there? Do you know? And like, what kind of insurance do they have in India? Is it like, does everyone have access? Is it easy to refer? Like, and it wasn't within the article. I don't expect you to just know this. It's more food for thought and to kind of spark conversation even among the other students if they're familiar with, the healthcare in India. Like, I don't know.
Yeah, I'll admit that I did not dive very much into the healthcare structure and the healthcare system of India. Um, but did do a little bit of background research. This specific medical center was a public funded public hospital, teaching hospital, and did mention in some other articles and also a little bit in the background information that genetic counseling is considered fairly new in India still. It's been around for a while. It wasn't
Okay.
explicitly mentioned, so who knows what a while means, but it is still considered a new specialty and not very accessible in India. It's still growing a lot, but there is the that consensus that it's needed. And
Mhm.
again, that focus on genetic conditions being prevalent in the population of India, which I wasn't very familiar with before this article.
Yeah. I'm I worked as a cardiovascular in cardio, and there's a lot of referrals, and I don't know, it was noted in the article, and I never drew the overlap with people of Indian descent and cardiovascular. But now that
Mm.
it's based, the article's based in India and they mentioned cardiovascular. I was curious. Not that, I looked anything up, or I'm just, again, just really sparking conversation. And if any of the other students are interested, or have, read something, it'd be great to hear from them as well. Um, but yeah, anyway, it was it was really insightful, very good. And I do like the piece about the general practitioners. The question I have on that is, it goes back to 2010. That's
Mhm.
15 years ago. Like, and I don't know how many articles they pulled from 2010, but some of the negative feedback that they have were those older practitioners 15 years ago who might not even be practicing now, right?
Right, yeah.
So in some ways it's almost outdated. Like if you think about, genetic history, 2010 was like in the genetics world like a million years ago, right?
Yeah. Yeah.
Um, so, it would be great to see if that article had something that was a little more current, even looking at the current residents rather than people who
Mhm.
are practicing from 2010, general practitioners, or, maybe residents looking at, being a general practitioner. I don't know. It was, again, nothing that you did. It was more just, looking at the article and sort of thinking about it from the point of view of as a genetic counselor, and like how long ago was 2010? Like, for you guys who are so young,
A
that was
long time
forever
ago.
ago.
Yeah. No, that's certainly an excellent point. Yeah, I don't recall at this moment. I'd have to look at the article again. There were several tables listing, different information in articles that break down. Um, I'm sure one of them may have examined more how many articles were from which kind of
Yeah,
decade, so to
I mean,
speak,
they
or
got it down to
area.
65, so
Yeah,
the N in the end wasn't a huge number. So they probably had to use 2010 to get a bigger N. That's what I'm guessing.
absolutely. Yeah,
But I don't know, um
yeah.
I'm not really very familiar with like the searches that they did when I read them. Adriana might know. That's sort of like up her alley. She probably knows that way better than I do. But yeah, 2010 was just forever ago.
Yeah, one thing that was mentioned in that article, and it was only mentioned in like two sentences, was that one trend they found in a study was that younger physicians
I
reported,
read that.
yeah,
Yeah.
reported more of an interest compared to, physicians of other ages. That wasn't very specifically defined, so I didn't include it here as
Right,
one of
right.
the main points, but I thought that was an interesting point and does speak again to, well, older physicians practicing in maybe 2010 would have a very different opinion potentially about utilizing genetics compared
Right,
to, younger physicians.
right.
Absolutely.
Like, I don't even know if like panel testing was available back then in 2010, right? Like, I don't know.
There were
If-
some, but the I think the big change was that the actual curriculum in medical schools like started to include the genetics. It's kind of hard for you to be on board with the discipline that throughout your academic career you never learned about, or like maybe you had
Right.
one class, like, oh yeah, I remember like someone mentioned something about genetics versus
Yeah. Oh,
actually having
Punnett
a
Square.
course. Right, exactly. Versus actually having a course on it, and then you become more familiar. That could be why the younger, and then
Right,
there's also I mean, granted, we don't know all, like there was a lot of countries that were sampled, but now
right,
there's even like commercials on TV about like,
right,
colon screening, like things that before people like didn't know what genetics was, right? Like, but even the direct to consumer companies, I feel have been doing a big job of educating people about like ancestry versus trait testing, and just reaching out a lot more to the community, making both the general population, but then by default then the professionals have to get educated as well. So I think that exposure is probably why the younger professionals, younger, I don't know what they defined as young, but like people who graduated more recently would probably be more on board of with genetic counseling. And I have to say, like, when President Obama made the big push about precision medicine, I
Mm,
think that brought a lot of attention. And you probably remember Angelina Jolie and her breast cancer case, right?
right.
Like all of these things that brought genetics to like the public view, and made people aware that like, oh yeah, we need to pay attention to this. But I do have a question on this. Like, so you all like are doing rotations now, right? So do you encounter any, or have any of you encountered any referrals from primary care physicians or nurses, or do you have like maybe, I don't know, like board meetings, like tumor board meetings, for example, with nurses as well? Do you get to see any? Um, can you give me a feel of, you know, do you get any referrals from primary care or no?
Yeah, in I just did my oncology rotation this past fall, and it was I would say not quite equally mixed, but maybe a third of our referrals were from people that were unaffected, referred for a family history, and oftentimes referred from their primary care provider, or also from eh, like the breast cancer prevention clinic for
Mhm.
people that are at high risk for breast cancer that were referred by their primary care provider but hadn't seen genetics yet, but were again unaffected and referred based on their family history. So definitely seen a substantial amount of primary care referrals in my oncology rotation for unaffected patients. Um, and then in my prenatal rotation, I'm going into pediatrics next, but in my prenatal rotation, excuse me, we did get some referrals for folks not necessarily that were pregnant, but for preconception consultations regarding medication usage and impact in pregnancy. And those were often referrals from their primary care providers. It definitely wasn't as substantial of an amount. I would say maybe, 5 to 10% of referrals and cases that I saw were of that variety, but it certainly was interesting to participate in those cases and counsel those patients because it was just totally different mode of counseling.
And that's also reassuring that you're getting those referrals. the others on the phone, like, have you had such referrals as well? Lacey or Erica?
Yeah, I would say like for my cancer rotation, I think it was maybe like 20 or 30% primary care. So, and yeah, it was mostly just for family history or like, and sometimes it would be like incorrect, like it would be like a cervical cancer family history. And so it would be a pretty simple session.
Interesting. Thank you. Thank you for sharing.
Oh, yep, Erica just saw your message. Yes, you will be coming into your rotation soon enough. They will be coming up on you.
Any other questions for Alysia? Right, so round of applause again. You did a really good job. Thank you so much for choosing this topic.
Yeah,
So, yeah,
it was
great.
very good. Thank you.
Well, thank you so much for your time again and reviewing my presentation. And I appreciate the guidance and your fabulous contributions to discussion as well.
Yeah, thank you. Have a great night.
You too. Take care now.
Yeah, enjoy your evening and Happy New Year, everybody.
Happy New Year.
Bye.
Bye-bye.